Exophthalmos, overview and surgical practices. Definition: exophthalmos, also known as proptosis, refers to the abnormal protrusion of one or both eyes from the orbit. It is often associated with underlying conditions such as thyroid eye disease, Graves' orbitopathy, orbital tumors, trauma, infections, or vascular malformations. If untreated, it can lead to complications like corneal exposure, ulceration, vision loss, and cosmetic disfigurement. Etiology and pathophysiology. 1. Thyroid eye disease, TID, the most common cause. Immune-mediated inflammation and fibrosis affect the orbital fat and extraocular muscles, leading to increased orbital pressure and proptosis. 2. Tumors includes benign or malignant lesions like hemangiomas, lymphomas, or metastases. 3. Trauma. Orbital fractures or retrobulbar hematomas may push the eye forward. 4. Infections. Orbital cellulitis or abscesses can cause unilateral proptosis. 5. Vascular lesions. Examples include carotid cavernous fistulas and orbital varices. Diagnostic workup. 1. Clinical evaluation. Measurement of exophthalmos using Hurdle's exophthalmometer. Assessment of visual acuity, extraocular movements, and corneal integrity. 2. Imaging studies. CT scan, useful for assessing bony structures, masses, or fractures. MRI, ideal for soft tissue evaluation such as muscle enlargement in TED or orbital tumors. 3. Laboratory tests, thyroid function tests, TSH, T3, T4 in suspected TED. Inflammatory markers and cultures for infections. Indications for surgery. Surgical intervention is often required when conservative management fails or for specific indications such as 1. Vision-threatening complications, optic neuropathy due to orbital compression, severe corneal exposure causing ulcers. 2. Disfiguring proptosis. 3. Orbital tumors or masses. 4. Post-traumatic reconstruction. 5. Persistent functional issues like diplopia. Surgical procedures for exophthalmos. 1. Orbital decompression surgery. Purpose: to relieve pressure within the orbit by removing bone or fat, thereby allowing the eye to retract to a more normal position. Approaches: medial wall decompression removes the ethmoid bone. Lateral wall decompression resects part of the greater wing of the sphenoid. Inferior wall decompression removes part of the orbital floor. Fat decompression targets orbital fat to reduce volume and pressure. Indications: moderate to severe proptosis, compressive optic neuropathy. 2. Orbital tumor resection involves removal of benign or malignant orbital masses via transorbital, transcranial, or endoscopic approaches. 3. Lid surgery addresses eyelid retraction or lagophthalmos, inability to close the eyelids completely. Procedures include tarsorrhaphy, lower lid retraction repair, or placement of gold weights in the upper lid. 4. Strabismus surgery to correct double vision caused by misaligned eyes. May involve repositioning or loosening of extraocular muscles. 5. Repair of traumatic injuries. Reconstruction of the orbital floor or walls using grafts or implants. Surgical complications. Infection, hemorrhage, over or undercorrection of proptosis, new or worsening diplopia, optic nerve damage, scarring or persistent cosmetic concerns. Postoperative care. 1. Monitoring and management, frequent assessments of visual acuity and orbital status. Use of corticosteroids to reduce inflammation, lubrication to prevent corneal exposure. 2. Rehabilitation, physical therapy for eye movement restoration, cosmetic adjustments if necessary. Advances in surgical techniques. 1. Endoscopic approaches, minimally invasive with reduced morbidity and faster recovery. 2. Customized implants, 3D printed implants for precise reconstruction. 3. Navigation-guided surgery, improves accuracy in orbital decompression and tumor removal. Conclusion: the management of exophthalmos, particularly through surgical interventions, requires a multidisciplinary approach involving ophthalmologists, endocrinologists, and surgeons. Early diagnosis, appropriate surgical planning, and advanced techniques are essential to optimize functional and aesthetic outcomes while minimizing complications.